Hi, Sriyal. It's really nice to have you in our at-home newsletter where we discuss the COVID. Please tell us a little bit about yourself and the work that you're doing for the community.
Thank you for having me. I am currently a program officer for a GF-funded regional grant. That's the SKPA program. I am working with the Family Planning Association, who's the SR on the regional grant. Apart from that, I work around in social media and use social media to communicate about what it's like to be positive and living with HIV, as well as promote messaging around treatment as prevention, as well as other advocacy-related work for PLHIV.
When the COVID happened, I'm sure there was a whole other life before the COVID took place. Can you tell a little bit what life was like before the COVID took place?
So before the COVID took place, I think we were figuring out a more streamlined approach to service delivery, as well as trying to mitigate certain barriers that are there socially, as well as on a policy level in terms of accessing services, reducing stigma and discrimination, and pushing out positive communication messages. But with the COVID, what happened was everything had to be halted and programs had to be halted. We had to take precautionary steps in order to stop the spread of COVID. And as a result of that, a lot of services that were provided for community members, including PLHIV, had to be restructured around the new normal.
We have a few examples of the response to the PLHIV community when the COVID happened. What kind of issues did it cause for the community?
So we have about 37 clinics across the country, but access to these clinics became limited. They had to only take people in on a need basis. That also meant that people weren't able to get medication easily. They weren't able to get through their testing. So as a result, from the national program, they mediated a way in order to deliver medication, which is a bit of a challenge because we have to also work with confidentiality and privacy, especially living in a country like Sri Lanka, where the PLHIV is highly stigmatized. It's not easy to manage that situation when that happens. So what we did was we worked with the PLHIV organizations in order to network with members of the organizations. Also, we reached out to other organizations who knew there were PLHIV within their sort of membership, so that we can then connect them with the organization that was doing the medication delivery, so that we were able to effectively provide medication. Another problem was that some of the people who were in, say, different city areas came from village areas or out of city bounds, which meant during lockdown, they went back into living with their parents or hometowns. So they weren't able to visit the nearest clinic because they were afraid that their HIV status will have to be disclosed, and that would be a problem.
For you as Sriyal, were you able to do your work or was it possible for you to do your work safely? How did it change your work style?
So what we ended up having to do was we actually halted any service-related programs, and none of the outreach work happened. My program also halted because we weren't able to communicate effectively with partners. We were more concerned about everyone's health, and FPA was very strict on following government-sanctioned guidelines. And it's only actually starting September that we're actually coming back to office every day. But previously, we were trying to investigate or explore options virtually to see how service delivery, meeting, any other sort of program related work can happen. So we wanted to restructure how we did certain things. So as a result, now we offer programs that are virtual as well as physical, so that it makes it easier for people to join and make them comfortable so that they feel safe.
With all the issues that there already are, like stigma or discrimination against PLHIV, do you see that extra issues have been caused since the pandemic took place?
From my point of view, with my program and my work, what I am seeing is that it's evident that the capacity of not just PLHIV, but the organizations that are working around HIV, there is a need for people to get on virtual platforms. And then there is a need for IT literacy that needs to be improved in order to not let that gap get further, even for people to sort of uh, meet convene, but also reach out for the resources. That knowledge needs to be provided. And that's one of the things that was highly evident with COVID and being locked down, that people didn't have a remote working policy or a plan or a strategy around it. In terms of PLHIV, what we are realizing on a community level is that the, the intricacies of a person's challenge, which affects their employment, which affects their sort of livelihood. We didn't have a system to properly address issues and gaps that happen in terms of livelihood, because we understand that when they're faced with difficult situations, taking medication or taking a pill a day becomes less important, and you have to prioritize yourself, your loved ones, and finding food and making sure that people around you are safe and able to manage becomes priority. So we realized that we needed a better system to support people who required livelihood support, etc.
Do you feel that you have to, of course, you had to adjust because of the COVID? Do you feel like your work or organization has now like a backup plan for the future, that you are more prepared if this happens again?
Yeah, I mean, it made us sort of take a hard look at how we operate as systems in terms of even offering virtual meeting facilities. We are also looking at carrying out training programs virtually. Apart from the traditional sort of webinar type, we're looking at learning management systems to provide trainings on HIV, which means that we're not only going to be reaching a small population of people to get trained, but we can actually open that up to a wider array of people. It's also forced community organizations to reach out to emergency services, which by extension, they are able to now set up an emergency mechanism for those organizations and communities. So yes, I mean, it has had a certain effect on how we carry out our work.
Do you feel like there were lessons learned from the COVID or messages that you took from this pandemic or in the community?
Yeah, take health messaging seriously. I mean, this is not something, the pandemic is not something new. It's not something that we just got to know out of the blue. It's something that people have been warning us about for years. And my fear is that even after having gone through 2 or 3 months of lockdown, we tend to forget how bad things were. And I think the lesson that we should take away from this is that even if it's not COVID, there is something else that can affect our work, affect the kind of work that we've been building up to. So we have to find alternative plans and solutions and learn from the fact that we do need systems to work remotely. We do need systems to help community members, not simply just testing and treating, but also uplifting their lives. That is available even during difficult situations. And community organizations definitely need the capacity, they need resources in order to carry out the work that they're doing with communities. So these are the kind of lessons that keep resonating through the program post pandemic.
With all the issues, is there one way of help? If you had one option that you say, this is what we need the most at this very moment for our community in this country?
I think a couple of things. One most important thing is, I think the long term wise, what is helpful is the capacity, the literacy to do your work, to find resources to carry out your work and keep it sustainable, but also to uplift other community members so that you can have a continuous service delivery mechanism within community organizations. That's the long-term sort of goal. On a short-term goal, we do need resources to help people's livelihoods. We understand that within our programs, unless it's an emergency service, there aren't systems in place to provide livelihood support. It's scarce. So those are the two kind of short-term and long-term capacity as well as immediate support. That's what we're looking at.
Through your work, you're helping people, and especially with this pandemic, it's more needed than before. What has been the reaction from the people in the community or in PLHIV towards your help or your work?
I think there's much more networking around people and coming together for the cause, which is great. Apart from that, because we didn't have livelihood support available, a few of activists, we got together and we raised money to provide livelihood support, immediate support, apart from the emergency programs that were coming in. So which opened up support to general public who were looking to support other community members who were providing donations in order to keep it going. So it's been a community coming together to a certain extent, so which is really great, and I think it's encouraging to see that people still do come together when things go wrong.
Final questions, Sriyal. Is there a message you would like to share for our viewers or the people from the community?
Yes, my biggest message, I think, what I've understood is support comes and goes. We need to be able to look back as to why we got into this. I think through the programs, we forget once we start meeting donor expectations, once we start getting into the grind, things become very monotonous and you get from one objective to another objective. But truly, the essence of why we get into this work is to support community. So we do have to pre plan difficult situations, and we also have to uplift other community members, so someday when we are not around, that there are other people to take this work forward, and eventually that there is no need for people like us to keep doing community work, that we will all sort of have better options and better sort of access for services. So I think the end goal is that, and the message is to look back at your work in retrospect and understand the the crux of why you got into this work, and make sure that that's what keeps you going.
So, are you optimistic about the future despite the pandemic? Yes or no?
I think we have to make best of the situation, right? I think I come from this mindset where, okay, fine, things don't always go as you plan, but you still have to make the best of the situation. And there is no reaching perfection. Once you have a solid plan and a goal, you try to achieve it as much as possible. So I am, to a certain extent, optimistic. I do hope that things get better.
Okay, that was it. Thank you so much, Sriyal, for your expertise. It was interesting. And thank you for joining AppCom in the newsletter.
Thank you for having me.
So much. Have a nice week. Bye.
You too. Bye bye.